Hello and welcome. My name is Lisa Eggert. As a Senior Account Manager at Delta Dental, I work with the retirement system to oversee its dental plan and to provide input for anything that relates to its dental benefits. My goal in the presentation today is to help you better understand your Delta Dental plan. We'll review the plan changes for 2026, key terms, and your 2026 cost share information. I'll also explain how the plan works, including how your provider choice affects your out-of-pocket cost, so you'll be able to maximize your dental dollars. Lastly, I'll review available resources for your dental plan, including how to contact Delta Dental. Our first topic is dental plan updates. The retirement system has reviewed the dental plan and is excited to announce that there will be several enhancements that will take effect in the 2026 plan year. Effective January 1st, 2026, the following benefit changes will be implemented for your dental plan. Aesthetic restorations such as porcelain and porcelain fused to metal will be allowed on posterior teeth and no longer considered an optional treatment. The special healthcare needs benefit will be added to allow for additional cleanings, visits, and/or treatment modifications for members, both children and adults, with a qualifying special health care need. Evidence-based benefits will be added to allow for additional cleanings and/or fluoride for members with specific at-risk health conditions. You can find more information about the special health care needs and evidence-based benefits on the Retirement System Health Seminar website under Delta Dental Documents and on our website at deltadentalmi.com/MPSERS. In continuation of the previous slide, 2 additional cleanings will be allowed with documented periodontal disease. Lastly, overdentures will be allowed and no longer considered as an optional treatment. In addition, this change for overdentures will allow for services on remaining teeth to be covered. Our second topic is key terms. These terms are important because they'll be discussed throughout our presentation. Before we get to the specifics of your dental plan, let's review these key terms. This slide will cover important dental terms. Coinsurance is a fixed percentage of the cost you share with your retirement system. The coinsurance changes based on the type of service that is being provided. Deductible is the amount you pay each year before your retirement system begins to pay. It remains the same in 2026. Annual maximum is the most that your retirement system dental plan will pay in a calendar year for diagnostic and preventive services, basic services, and major services benefits. Orthodontic lifetime maximum is the most your retirement system dental plan will pay the entire time you're enrolled in the plan for orthodontic services. Coordination of benefits is the way claims are paid when there's more than one dental benefits plan. Your retirement system dental plan uses the carve-out method to process coordination claims. Visit deltadentalmi.com/MPSERS or contact Delta Dental for more information if you have more than one dental plan. The next topic is provider options. The type of provider you choose determines how the claim will be paid, so it's important to understand the differences between the types of providers. With the retirement system dental plan, you have the freedom to choose any dentist. If you consider all the dentists that are available, you can place them into 3 categories: Delta Dental PPO, Delta Dental Premier, and non-participating. The retirement system dental plan is designed to offer the maximum benefit with the lowest out-of-pocket expense when you use a Delta Dental PPO dentist. You'll save the most money when you use a Delta Dental PPO provider because all claims, regardless of the type of provider, are reimbursed at the Delta Dental PPO approved amount. This is the reimbursement rate that a Delta Dental PPO provider has agreed to accept. You'll likely pay more when you use a Delta Dental Premier or non-participating dentist because their fees are higher than the Delta Dental PPO approved amount. Let's review each of these provider types. Delta Dental PPO providers are the first type of provider that we'll review. When a Delta Dental PPO provider joins our network, they agree to accept the Delta Dental PPO approved amount as payment in full. That means you're only responsible for your coinsurance. Also, as a participating provider, the Delta Dental PPO provider cannot charge you the difference between the submitted amount, which is the amount they would normally receive for services, and the Delta Dental PPO approved amount. In other words, they're not allowed to balance bill you. As part of the provider's participation in our network, we pay the participating provider directly. The retirement system has designed the dental plan to pay the highest level of benefit when you receive services from a Delta Dental PPO provider due to the lower coinsurance amounts. As an additional advantage, there is no deductible for any type of service when services are performed by a Delta Dental PPO provider. Although a Delta Dental Premier provider also participates with Delta Dental and offers discounts off their submitted fees, they do not accept the lower Delta Dental PPO approved amounts. So, when you receive services from a Delta Dental Premier provider, you pay your coinsurance plus the difference between the Delta Dental PPO and Delta Dental Premier approved amounts. Because the Delta Dental Premier provider is a participating provider, there is no balance billing between the Delta Dental Premier approved amount and the submitted amount. Once again, as noted with the Delta Dental PPO providers, as a participating provider, we'll reimburse the Delta Dental Premier provider directly. Lastly, there is a deductible that applies to basic and major services when receiving services from a Delta Dental Premier provider. The last type of provider is a non-participating provider, which means the provider doesn't have a contract with Delta Dental and is not required to offer a discount or follow any of the guidelines that we set for our participating providers. When you go to a non-participating provider, you're ultimately responsible for the dentist's submitted amount. A non-participating provider will likely cost you the most money because you pay your coinsurance plus any additional cost up to the provider's charge. This means that a non-participating provider can balance bill. As noted with the Delta Dental Premier provider, a deductible applies to basic and major services when you receive services from a non-participating provider. When you go to a non-participating provider, you'll likely be required to pay the entire cost of the service upfront. Since a non-participating provider is not required to submit a claim to Delta Dental, you should confirm whether the office will submit the claim for you. To receive your reimbursement from the plan, we need to receive the claim. So if the claim is not submitted by the non-participating provider, you'll need to send it to Delta Dental. As a side note, our participating providers in the Delta Dental PPO and Delta Dental Premier networks are contractually required to submit claims for their patients. This slide is an overview of the 3 different types of providers, and it shows a side-by-side comparison. The Delta Dental networks continue to offer many options when it comes to providers and locations across the United States. Nationwide, 3 out of 4 licensed dentists participate in the Delta Dental PPO or Delta Dental Premier networks. In Michigan, nearly 90% of the licensed dentists who practice participate in the Delta Dental PPO or Premier networks. With Delta Dental PPO providers, you only pay your coinsurance. There's no balance billing, no deductible on any of the services, and you receive the highest benefit level. With Delta Dental Premier providers, you pay your coinsurance and the difference between the Delta Dental PPO and Delta Dental Premier approved amounts. There's no balance billing, and you have a deductible that applies to basic and major services. And lastly, with non-participating providers, you pay your coinsurance and any additional amounts up to the provider's charge. You can be balance billed by the provider, and you have a deductible that applies to basic and major services. Since the type of provider that you choose determines how the claim will be paid, it's important to have a good understanding of the types of providers. I've included some additional notes about providers that you may find helpful. Your dental plan allows for access to participating providers across the United States. So no matter where you live or travel, you can seek dental services from Delta Dental participating providers. If you're out of state, it's important to let your provider know that claims need to be submitted to Delta Dental of Michigan to be processed and pay, since that's where you have coverage. Although all providers outside the United States are considered non-participating providers, out-of-country claims may be submitted for reimbursement. If you're searching the Delta Dental provider networks, you may notice that sometimes a provider participates in both the Delta Dental PPO and the Delta Dental Premier network. If that's the case, we'll automatically process the claim using the Delta Dental PPO network status when the claim is submitted. This means you'll receive a higher benefit level and a deeper discount on the cost of the claim. Please note that a provider may have a different network status based on the office location, so be sure to confirm with the dental office where treatment is received. Feel free to provide a copy of the coverage overview flyer to your provider so they can better understand your dental benefit. Lastly, an office could have both Delta Dental Premier and Delta Dental PPO providers. If you want to see a Delta Dental PPO provider because you'll receive a higher level of benefit and a deeper discount, let the provider office know that you only want to see a PPO provider because of the way your dental plan pays out benefits. Participating status is based on the provider and location, not on the office. The next topic is your 2026 cost share. As noted on this slide, your cost share includes your coinsurance, which is a percentage of the Delta Dental PPO allowed amount, and any applicable deductible. I mentioned earlier that your coinsurance will change based on the type of service that's provided. Coinsurance is also affected by the type of provider you see. You'll notice two columns on this slide. The first column represents Delta Dental PPO dentist, and the second column, Delta Dental Premier and non-participating dentist. As you can see within the diagnostic and preventive services category, there's a lower coinsurance when you receive services from a Delta Dental PPO provider. This means you'll have lower out-of-pocket cost. If cleanings and exams are done by a Delta Dental PPO provider, you'll only have a 5% coinsurance. If the same services are done by a Delta Dental Premier or non-participating provider, the coinsurance is 10%. Your plan will pay for cleanings and exams twice within a calendar year. This means that any time between January 1st and December 31st, you can have 2 cleanings and 2 exams. As noted earlier, effective January 1st, 2026, 2 additional cleanings will be allowed with documented periodontal disease. In addition, if you qualify for the special health care needs or evidence-based benefits, you may also be eligible for additional preventive services. If you go to a Delta Dental PPO provider for an X-ray, the coinsurance is 5%. If the same X-ray is done by a Delta Dental Premier or non-participating provider, you'll have a 25% coinsurance. The next category of service is basic services. This is where the bulk of your dental procedures fall. Within this category, you'll have minor restorative services, which are fillings, major restorative services, which are crowns, periodontic services, which are anything that has to do with your gums, endodontic services, which are root canals, oral surgery services, and relines and repairs to existing dentures and implants. As you can see within the basic services category, fillings have a lower coinsurance when you go to a Delta Dental PPO provider. and the coinsurance is 20%. If you go to a Delta Dental Premier or non-participating provider for fillings, the coinsurance is 25%. All the other services within this category have a 25% coinsurance for Delta Dental PPO, Delta Dental Premier, and non-participating providers. Even though all providers have a 25% coinsurance, you'll save the most money when you go to a Delta Dental PPO provider. Later in this presentation, we'll review a payment example to see how the type of provider affects how we process a claim. You'll also note that within the basic services category, there is a deductible for services that are performed by a Delta Dental Premier or non-participating provider. This deductible is also applied in the major services category. Major services include prosthodontic services, which are anything to do with replacing missing natural teeth or adding fake teeth. These services can include bridges, dentures, and implants. Within this category, the coinsurance is 50% for all types of providers: Delta Dental PPO, Delta Dental Premier, and non-participating. Remember, even though all providers have the same coinsurance amount, you'll save the most money and have the lowest out-of-pocket expense if you go to a Delta Dental PPO provider. You'll find more detailed information on the dental benefits categories in the coverage overview flyer. This flyer can be found at deltadentalmi.com/MPSERS. As noted on an earlier slide, the annual maximum is the most that your retirement system dental plan will pay in a calendar year for diagnostic and preventive services, basic services, and major services, which are the services we discussed on the previous slide. From January 1st to December 31st, every time the plan makes a payment on a service, that amount is deducted from the $1,100 annual maximum. Once the plan has paid $1,100 for services, your annual maximum will be maxed out and your plan will no longer pay for services. You can continue to get services done, but you'll pay out of pocket for those services. It's important to note that if you're receiving services from a Delta Dental PPO or Delta Dental Premier provider, you'll continue to receive the discounted amount based on the type of provider, even if you're over your annual maximum or getting a non-covered service. It's important to look at your explanation of benefits after a claim has been paid to make sure that the amount you paid your provider matches the patient payment shown on the explanation of benefits. If these amounts are different, contact Delta Dental Customer Service and we'll reach out to the office to resolve the discrepancy. Each person covered on your dental plan has their own annual maximum of $1,100 to use throughout the year. At the end of the year, whether you've used all, some, or none of your $1,100 annual maximum, you'll start with a brand new annual maximum of $1,100 on January 1st of each new year. The orthodontic maximum is different because it's a lifetime maximum. This means that for orthodontic services, the most the retirement system dental plan will pay during the entire time you're enrolled in the retirement system plan is $1,200. Every time an orthodontic service payment is made, the amount is deducted from the $1,200 orthodontic lifetime maximum. Once the dental plan has paid $1,200 for orthodontic treatment, there will be no more payments made for the orthodontic services. Orthodontic services are only covered for dependents up to age 19. This dental plan also includes an annual deductible. The deductible is the amount you pay each year before your retirement system begins to pay. The deductible is $50 per person per calendar year and only applies to basic and major services when you go to a Delta Dental Premier or non-participating provider. There's no deductible for diagnostic and preventive services for all provider types, and there's no deductible if you receive services from a Delta Dental PPO provider. Lastly, the retirement system's dental plan has a carve-out clause for coordination of benefits when the plan pays secondary. This carve-out clause affects the way in which claims are paid when there's more than one dental benefits plan. For more information, please review the How Coordination of Benefits Works flyer at deltadentalmi.com/MPS-ERS. In this payment example, we have a crown, which is also called a major restorative service and is part of the basic services category. As a reminder, when you have a basic and/or major service done by a Delta Dental Premier or non-participating provider, you'll have a deductible, and that's shown in the example here. As we begin, you'll notice on the left side of the screen that we've displayed the three types of providers that were previously discussed. The first provider type is the Delta Dental PPO dentist. As you can see, this Delta Dental PPO dentist charged $1,400 for the crown. But because they participate in the Delta Dental PPO network, they agreed to accept $896 for the service. The PPO approved amount is $896 and is the amount that will be allowed on all claims. Because this provider participates in the Delta Dental PPO network, they cannot balance bill you the difference between the $1,400 charge and the $896 approved amount because there is no balance billing. Since this crown is placed by a Delta Dental PPO provider, there is no deductible. The coinsurance, which is 25% for major restorative services, is applied to the Delta Dental PPO approved amount, so we have 25% of $896, which equals $224. Since the Delta Dental PPO provider has agreed to accept the Delta Dental PPO approved amount as payment in full, there's no additional cost when you receive services from a Delta Dental PPO provider. The out-of-pocket cost for a Delta Dental PPO provider in this example is $224. The Delta Dental Premier dentist is shown in the next row. In this case, the Delta Dental Premier dentist also charged $1,400, but because the dentist is in the Delta Dental Premier network, the approved amount is $1,070. However, the plan will only reimburse the Delta Dental PPO approved amount on all claims, which is $896. Because this provider participates in the Delta Dental Premier network, they cannot balance bill you the difference between the $1,400 charge and the $1,070 Delta Dental Premier approved amount. If we look at the member cost share, we'll see the $50 deductible because this is a Delta Dental Premier provider, and it falls in the basic services category. Moving to the coinsurance, we apply the 25% coinsurance to the Delta Dental PPO approved amount, which is the same as the allowed amount. Because a deductible of $50 was paid, we'll deduct $50 from the Delta Dental PPO approved amount first. So $896 minus $50 is $846. So 25% of $846 is $211.50 of coinsurance. The additional cost for this Delta Dental Premier provider is the difference between the Delta Dental Premier approved amount of $1,070 and the Delta Dental PPO approved amount of $896 that is paid on this claim. So the additional cost is $174. If you total up all the components of the member cost share, which includes deductible, coinsurance, and additional cost, the out-of-pocket cost for this Delta Dental Premier example is $435.50. The last row shown is a non-participating provider. In this case, the non-participating provider also charged $1,400, but it's important to note that when members go to a non-participating provider, they're ultimately responsible for the charge. In this case, the non-participating approved amount is $1,400. However, the plan will only reimburse the Delta Dental PPO approved amount on all claims, which is $896. If we look at the member cost share, we'll see that because this is a basic service done by a non-participating provider, there is a deductible of $50. Moving to the coinsurance, we apply the 25% coinsurance to the Delta Dental PPO approved amount. Because a deductible of $50 was paid, we would deduct $50 from the Delta Dental PPO approved amount first. So $896 minus $50 is $846. So 25% of $846 is $211.50 of coinsurance. The additional cost for this non-participating provider is the difference between the non-participating approved amount of $1,400 and the Delta Dental PPO approved amount of $896 that is paid on this claim. The additional cost is $504. If you total up all the components of the member cost share, which includes deductible, coinsurance, and additional cost, the out-of-pocket cost for this non-participating example is $765.50. As you can see from this example, even though the coinsurance is the same at 25% for all provider types, the type of provider that you choose determines how the claim will be paid and ultimately your out-of-pocket cost. You'll save the most money in the retirement system plan if you receive services from a Delta Dental PPO provider. Members often ask if there's a way to receive an estimate for services they need. The answer is yes. You need to ask your provider for a pre-treatment estimate. When your provider submits a pre-treatment estimate to Delta Dental, we'll provide information about how the dental plan will cover the service and your out-of-pocket cost. This information is helpful as it may lead to further discussion of treatment options with your provider. Let your provider know that you want the pre-treatment estimate submitted to Delta Dental. When this pre-treatment estimate is submitted to Delta Dental, the estimate runs through the claims processing system as if it were being processed and paid. It will provide information on the current annual maximum available, whether the service is denied due to time limitations, and whether the service is covered by your retirement system dental plan. You'll know this was done because Delta Dental will provide a copy of the estimate to both you and your provider. Please remember that the pre-treatment estimate is subject to the amount of your annual maximum available at the point in time the request is received. If you have additional services done after the estimate, it may impact the payment amounts for the procedure that was sent for a pre-estimate. The last topic we'll cover is helpful resources. To provide materials and information that are specific to the retirement system dental plan, we have a designated website for the retirement system. The link for this site is located on the Michigan Office of Retirement Services website or can be accessed directly at deltadental.mi.com/MPSERS. On this site, you'll be able to access specific information about your retirement system dental plan, access written plan documentation, view this presentation, search the dentist directory for a provider, and find a link to the member portal. The Delta Dental member portal allows you to access your specific dental plan information once you've created an account. Once you've logged into the member portal, you'll be able to view the family members covered on your plan, find an in-network dentist, see information on common procedures, view and print a specific explanation of benefits, check your annual maximum use to date, access and print an online ID card, and view the status of all claims. The member portal website can be viewed on all devices. The best way to find a provider is to search the online provider directory. These directories have the most up-to-date information available. If you're not comfortable using the online directory, you can always call customer service and request a listing of providers near a certain address or zip code. You can search for a dentist on the Delta Dental corporate website or on the website that's specific to the retirement system. The Find a Delta Dental Participating Dentist flyer at deltadentalmi.com/MPSERS provides step-by-step instructions on how to search for a provider. Once you've selected Find a Dentist and searched for a Delta Dental PPO and Delta Dental Premier provider, you'll see the screen that's shown here. In the first box labeled Specialty, you can search for a specific dental specialty or search any specialty, which will include all results from all provider types. In the second drop-down box, you can choose the network to search. I recommend that you search the Delta Dental PPO network first because providers in the PPO network will save you the most money. You can also choose to search the Delta Dental Premier network to see what options are available. If you're looking for a specific dentist and have the dentist's last name, you can include that in the search criteria. You may also leave it blank. If you select Y for search by current location, the search will use your current location. If you select N for search by current location, an additional field will pop up for zip code, city, or address. Once you enter the requested information, select the green box labeled Find Dentist. Delta Dental has a smartphone app that's available for Apple iOS and Android users. To use the app, you need to create a member account. If you've already created a member portal account, the username and password are the same for the phone app. The phone app will allow you to access the cost estimator, view benefits, find a dentist, view claims, and view your mobile ID card. As a reminder, the member portal, which was discussed on a previous slide, has been designed to be viewed on all devices, so that option is also available. There is a link between oral and overall health, so this is a reminder to be wise about your oral health. Older teeth are more susceptible to decay, especially around old fillings and the gum line. To maintain a regular oral health routine, you should brush twice daily, floss at least once daily, and visit your dentist for regular cleanings and exams. If you have dentures, your dentures will fit better and last longer if you take proper care of them. To take care of your dentures, you should brush your dentures at least daily, remove and rinse them after eating, soak them overnight, and rinse them before putting them back in your mouth. Medications and medical conditions can affect your oral health. More than 400 medications can cause dry mouth, which prevents saliva from protecting your mouth against bacteria and decay. Furthermore, those who suffer from Alzheimer's disease may forget how to brush their teeth, and people who have osteoporosis may notice loose teeth from decreased bone density. These are examples of why it's important to understand your risk and recognize how your oral health can be impacted. Untreated gum disease causes damage to your gums and jawbone, which can lead to receding gums, loose teeth, and even tooth loss. Gum disease is linked to other health issues like heart disease, diabetes, and respiratory problems. Poor dental hygiene, tobacco use, bad diet choices, and medical conditions can increase the severity of gum disease and can be detected in the dental chair. As we wrap up this presentation, if you have additional questions about your dental plan, you can contact the Delta Dental Customer Service Department toll-free at 800-345-8756. Our advisors are available from 8:30 a.m. to 8 p.m. Eastern Time, Monday through Friday. We also have an automated system that's available 24 hours a day, 7 days a week. The automated system provides benefit, claims, and eligibility information, the Delta Dental mailing address, and names of Delta Dental PPO and Delta Dental Premier dentist near you. As a reminder, you can also access plan information and additional resources at deltadentalmi.com/MPSERS. Thank you for taking the time to review the information about your dental plan. I hope that the information provided will be helpful to you in maximizing your dental plan and minimizing your out-of-pocket costs. Have a great rest of your day.